As I said, today's webinar is communicating systems approaches to a diverse range of audiences. We're looking to examine how systems approaches are shared, translated and applied across research, policy and practice. And we have some brilliant speakers. So Professor ISBNPA from Amsterdam University Medical Centre, Adefunke Ogunleye from VARCE, Nigeria, and then we have Therese, Petersen and Clara Heinze from the Steno's Diabetes Centre, Copenhagen. So thank you very much for being here. We'll get started with the first presentation. So Mai, if you want to share your screen, and just as Mai is getting ready, I'll just introduce. So Mai leads the Child and Adolescents Public Health Research and Innovation Group as a full professor at Amsterdam UMC. Her research focuses on advancing epistemic and movement behaviour justice, specifically for youth, applying participatory system-based approaches. And she's deeply committed to equity and collaboration. Mai unites academic, community and youth partners to co-create inclusive and sustainable solutions connecting science and society. So welcome, Mai. Thank you very much for joining us. And yeah, over to you.
Thanks very much. I don't see anyone, so if something goes wrong, you just have to yell at me. Well, it's an honor to be here. Together with Adefunke, we are very happy to present our YOPA project, and YOPA stands for Youth-Centered Participatory Action. And it's a project funded by the European Union. Let me see if how I can get to the next slide. Yes. In YOPA, we combine two paradigms, participatory action research and systems thinking. And both paradigms are maybe a bit challenged by confusion, contradiction, and consternation, partly because of terminology. Different terms are used for either the same thing or the same term for very different things, like community-based participatory research, citizen science, participatory action research, co-creation, co-design. And the same actually goes for systems thinking. I have the experience that it's confused with multi-sectoral work or multidisciplinary work. The concept of non-linearity and feedback loops and leverage points are also often confusing, I realize and experience. And well, in YOPA, we had the audacity to combine these two confusing paradigms. So YOPA is a youth-centered participatory action approach, and it's focused on improving both the social and physical environments for teenagers in Africa and Europe, and making it more physical activity friendly, but also more youth friendly. And in YOPA, I'll explain the term, what we mean by participatory action research. So we PAR shifts the power to the research participants, so from the academic researcher to the research participants who become co-researchers. And that means that they agree on the research focus, they help shape research questions, decide on which methods to use. They also play a central role in collecting the data, analyzing the data, and also co-decide upon which action to take and also how to implement these actions and evaluate these actions. So we really work together with the research participants as co-researchers throughout all phases of the project. Luckily, I don't have to explain systems thinking in this SIG. So we do this in 4 countries: the Netherlands, in Amsterdam, Denmark, in Aalborg, Nigeria, in Osogbo, and in Soweto in South Africa. And together with the researchers, or I call them also the champions, the local champions, academic researchers in these 4 contexts, we also co-created the co-creation protocol. And that is also, as you can see in the line, it's also not a linear process. So we didn't develop a protocol, well, with 9 steps. You don't have to go through the details. But we decided a direction and actions, and the protocol emerged iteratively while implementing it in the 4 settings. So the co-researchers, the youth themselves, in that way also influenced the protocol. Yeah, so we started with mapping the local systems, and then at the moment, in some countries, actions are already implemented, but then the actions to improve the systems were tailored to the local settings and also implemented. And in a figure, it looks like this. And with this figure, we also wanted to emphasize that it's iterative. And so you learn by doing, and then you adapt, and then you learn more, and then you slowly move forward. So the mapping phase, the tailoring phase, and the implementation phase. And here the youth in the middle are the co-researchers, but it's not only about their own perspectives, but also about perspectives of their peers. So they also conduct research and collect data among a wider group of adolescents. We also involved, of course, the adult stakeholders, as they usually have more power to change things in the systems throughout the process. And we are also including a realist evaluation and a process evaluation. So that's, well, in general, the YOPA approach, and Adefunke will take over to zoom in how we did this in Nigeria.
Thank you very much, Mai. That was a great way to start the webinar, just to contextualise yoga and the framework and the protocols. Thank you very much. Adefunke, do you want to share your screen as well? And I'll also just introduce you as you're sharing the screen. So Adefunke is a public health practitioner and researcher and programme manager in the General and Education Department of Value Reorientation and Community Enhancement, VARCE, where she leads programmes focused on the development and empowerment of girls, young women and youth. She's involved in the Youth-Centred Participatory Action YOPA project, a multi-country initiative that engages young people in co-creating solutions to promote healthy lifestyles and reduce non-communicable disease risks, who work centres on adolescent health, youth participation and translating systems thinking into practice. So welcome, Adefunke. Thank you very much. And over to you.
Thank you very much. Good morning, everyone. Thank you so much, Prof. Mai, for that introduction. It's amazing and interesting. I will just continue from where she stopped, and I'll be focusing on the lessons that we learned from the Nigerian YOPA project, especially during the first phase, which is the mapping phase. And we've titled this presentation, "One Size Never Fits All, It Should Be Fun." And when it came to communicating system approaches to diverse audiences, because we actually had different audiences here alongside other countries as well. We had stakeholders, the community leaders, the influential leaders, the policymakers, the parents, the school administrators, the tutors, and actually had the youth as the co-researchers during this process. And I'll be dwelling more on the phase 1 of the project, which is the mapping exercise that we had. And so we realized that systems thinking only becomes real when people actually see themselves in it. You know, systems thinking can be very abstract. It can be very confusing because of the terminologies and the technical terms. But we actually had to come down to the level of our audiences and simplify things in order to get the results that we had. And also moving on, the YOPA project, like we've discussed earlier, adolescent health, we are supposed to look at adolescent health in like a holistic way, like knowing that it's not as a result of individual choice alone, but the outcome of all interacting factors like the social factors, the environmental factors, institutional factors, policy factors, all interacting together. So we needed to make sure that the adolescents actually understand the system and how they are related to the systems and how those connections affect them. And I'm looking at this illustration. It just talks about how YOPA works. By helping young people to see and influence these connections, we can see that young people are connected. The schools to the schools, families, different levels of the system, schools, families, communities, and we need to see how these old connections actually affect their movement behavior, physical activity. And so this was what we really did in the YOPA project. And the YOPA project, my first lesson in the YOPA project is really knowing the fact that we couldn't talk about those terminologies, because when we started talking about structures, diagrams, it was all confusing for the adolescents, really. And we actually needed to know how the best approach to adopt, to be able to communicate to them effectively. And really began with them actually telling us how they don't play outside anymore, how there are some barriers that they faced when it comes to, being physically active in their schools and also in their environments. So instead of telling young people what to do, we asked them to understand what around them makes elderly living, and in this case, physical activity, easy or difficult. And we know that communication actually matters a whole lot. So we had to adopt different strategies for communicating to them, communication turned the systems into something that they could recognize and relate to, and something that they could act upon. And system thinking was really grounded in their everyday life. So it made them relate better with it. I can remember a particular time that we needed to talk about theory of change to our adolescents, and it was just so technical. And we had to just think about the best way to do it. And then we actually had to ask questions about their daily lives. For example, we asked one of them how she goes about to make a favorite meal, like a favorite soup. She told us that she loves vegetables a lot. So we're like, okay, what do you do? How do you make sure that you actually get to eat the vegetables? She talked about the fact that she needed money to get funds, to get the ingredients she needed. We're like, that's inputs. Okay, activities, she would go to the market. She would, when she gets home, she cut the vegetables, she slices the onions and all that. Okay, those are your activities. Okay, after she talked about how, she was able to achieve a number of these things, and we were just relating it step by step to what they did every day. So this actually made them understand better all the technicalities behind the systems thinking and systems approach. And really, and at the end of the day, it actually had to do more with their stories and lived experiences. And this made it easier for them to be able to relate better with the whole process. And with adolescents, we avoided technical language, like I said, and we used a lot of their local language. We actually had to combine English language with their local language, so which made them easy for them to be able to communicate to us better. We used participatory research approaches. We used like mapping exercises, group discussions. We had peer-to-peer interviews, because we really needed to also build their capacity as well, because it's one of the components of the YOPA project. We also had interactive sessions facilitated by stakeholders. We had public health personnel as stakeholders. We had the urban planners. So all this actually helped us to be able to make sure that the youth understood what systems approach is all about. And we had the presentation. We had a lot of energizers as well that was imbibed in everyday session. And really, when we use these energizers, we realized that it made these tasks fun to them. It didn't look as if they were actually working, but while they were having fun, they were as well, identifying those barriers we needed to identify during the sessions. So it made it easier for them to even look forward to participating in the next session of the co-creation activity. So participation itself actually became a communication strategy, because when they were involved deeply, they understood a lot of things better. So they didn't need to learn the word systems; they already lived inside one already. So like we can see from this is a diagram talking of it's reflecting the one of the energizers we had with the teenagers. This was called In and Out of the Circle. And this one, we used this as a recap for the previous session. Like we, someone calls out instructions in, out, anybody that falls out of the instruction becomes the person to give us a recap of the previous activities. So everybody was trying not to definitely lose focus. So it was really fun for them as well. We also got the best out of them by using this method. And also we had games too. This one is actually called a grab the cup game. It actually helped them to exercise different parts of their body, their arms, their head. Somebody out there calls as instruction, they'll tell them to touch their head, their shoulders, their knees, and grab the cup. So whoever doesn't grab the cup goes out of the game until we finished all through. So it was really fun for them. Looking at this too, this is also one of the icebreaker that we had. It's called This Is My Name. It was actually what we had almost at the beginning of the sessions, at the introductory part of the projects, which helped them to be able to get to know their team members very well, because they are all students of the same school, but they are all in different classes. So they didn't really know themselves as such. But adopting this method actually helped them to be able to know the names of their team members, and they were curious more, so they built lasting friendship afterwards. Then this was a community tour that we had with the adolescents, and this actually helped them to be able to identify those spaces, the facilities, the resources in their environment, their communities that might help them to be physically active or not. And this was actually done through the photo voice approach, whereby we gave them our phones, cameras, because they don't have access to phones like that. So we used our own phones. They took pictures of different things that actually that actually relates to them, their physical activity status, and they were able to interpret what this pictures meant to them through storytelling. So this actually made us to understand their everyday life better, their lived experiences better, and it made us be able to also make informed decisions. And as we can see, they also play board games during their break times, and they are always so eager to come back for the next session. So this is exercise activities that they were having as well, stretching, Then also the second picture talks about a game called Think, Pay, and Share, whereby they thought about some things, they wrote it down, they talked to their peer about it, the brainstorm present. So all these really helped them to be able to communicate better with us. And before we were able to do all these things, we made sure that we were able to create a safe space for them to be able to express themselves. And actually started with us establishing teams agreements. We call it teams agreements, whereby they were able to tell us those things that will make them comfortable enough to talk and express themselves in our meetings. So we started by asking them, how do we create a safe space for everyone? How should we behave if someone disagrees, or if there's a falling out? How do we ensure that everyone arrives on time and wants to come? How do we ensure that everyone has the opportunity to participate and speak and contribute ideas? So they gave us a variety of answers that we had on a flip chart in the Yopa lab. We call it the Yopa lab, whereby we actually wrote those agreements, and everybody is reminded that this is what we live by in this session, and everybody is free to talk without being judged or laughed at, or being ridiculed. So it really made the sessions and the environment a very conducive one for them to really learn and express themselves. So we instead of asking them to be more active, we actually asked them why it's hard for them to be physically active in their environment, in their school. So this made them to be able to come out to us and explain to us all the reasons why they couldn't participate in more physical activity. For example, it might be conflicting timetables, the fact that they have limited resources in their school, the fact that even their parents at home don't want them to play outside because they are scared that they might get injured. We had different barriers that were identified, like the fact that their school, it was not well maintained. They had bushy spaces in their school that needed to be well cut, because if not, because of dangerous animals like reptiles and the like. So they gave us different reasons, or even gender inclusiveness, the fact that boys don't allow girls to play football on the field. So that means that the boys are the ones that are really doing more than the girls. So we had series of barriers that were identified by these teenagers. And also the stakeholders were not also left behind. When we needed to communicate with the parents, the teacher, the school administrators, we didn't use technical terms like feedback loops, influencing behaviors. We actually asked them that your students, your children can't exercise because there is no safe space, because we've been able to discuss with them and they gave us the reasons why they are not being physically active. And really the parents were able to look deeply too and then try to understand and identify those barriers that that their wards are facing. Like some of the parents talk about the fact that they know that sometimes house chores does not allow their wards to be able to participate in, to be active. And the fact that some don't even believe in them playing around. They feel like play is play, that play is not beneficial. They just feel like play is wasting their time. So they prefer for them to get home, do their house chores, and just read their books and sleep. So this session actually helped them to be able to reflect and understand better the reasons why they need to provide a space whereby their wards can actually exercise and do lots of movement behavior. And also even for the policymakers and the community leaders, we're able to let them know that it's the policies that are actually limiting movement opportunities in the school and in the community. For example, a school that does not have a physical and health education tutor, definitely they don't have enough time. There's even no time in the timetable for them to be able to participate or play outside. So we actually made all these things known, and it helped us get them better to be able to see where the lapses are. And this is something that has helped them to be able to shape the intervention that we are currently planning. And also in the African context, really, there's something about adults and children that when adults talk, children, they don't talk. Like you don't talk because it seems like a kind of disrespect, like being rude. So most times during our sessions, we might need to actually have separate sessions sometimes. And at the time we started having joint sessions because we've been able to bridge that gap. So it helped us to be able to get results. So this is one of the pictures seeing one of the stakeholders meeting that we had. We can see that the teenagers are still by the side. They are actually having their own group discussions, whereby we're actually having the session with the stakeholders as well, and they were able to identify the barriers in their school environments that are not helping the teenagers to be physically active. And this is one of the sessions that was being handled by one of the stakeholders, that is a public health personnel, whereby he was leading the exercise of the day. It was really fun for the adolescents. And this is a session that was facilitated by one of the urban planners, whereby he taught them about the community layout and design and how this affects movement behavior of teenagers and young people in their community. So it was really, really participatory session, and the listeners actually learned a lot about their communities and how the design and the layout is affecting their movement behaviors. So really for the UPRA project here in Nigeria, and we just realized that there's no single way to communicate systems thinking. We had to adapt different languages. We had to realize that participation itself becomes a communication tool. The fact that they are involved makes them understand this approach better. And the fact that even confusions, are actually part of the process. It should not be seen as a failure. So that's one of the key lessons that we learned during the UPA project. And at the end of the co-creation exercise, that's the phase one, we were able to come up with the first drafts of the systems map. As you can see, this is it, talking about the fact that they don't feel safe in the school environment. There's passive safety issues, that they don't have access to the outdoor school space because of bushy spaces. So all these were things that the co-researchers were able to identify through this approach that we adopted. And then I talked about the fact that we had to simplify a lot of things. So we avoided those technical terms. For example, when we talked about initiatives, they didn't understand. So we had to talk about the plan or idea or a new way of doing things. When we talked about facilitators, physical activity, they didn't understand. We had to talk about the fact that what are those things that makes it easy for people to do something? What are those things that makes it easy for you to be physically active? So we simplified the terms. We simplified perception. We simplified barriers, CMO, the context mechanism, and the outcome theory of change and the like. So all this, through using this method, actually made us to be able to get the best and the most out of the adolescents. Thank you very much for listening. Over. Thank you.
Adefunke, thank you very much. That was brilliant. It's really interesting to see a really applied example of how you made this work in practice. I particularly like the bit around participation being the way that you communicated, and also the misunderstanding as part of the process. That was brilliant, and the examples that you give for the various ways that you adapted as well. Thank you very much. I really enjoyed that. I know that we said we were going to do Q&A at the end, but just conscious that the presentations might be a bit different, so we just thought we'd open up for Q&A now. If someone had any questions, I can already start to see some coming in the chat. So if you're happy enough, Mai and Adefunke, I can just ask them. Is that okay? So Hannah has a question around how did you identify all stakeholders?
Mai, are you okay?
I think you're the perfect person to answer that.
Okay. So what we did was that at the beginning of at the planning phase of the project, we already identified the community that will be working. So we made inquiries about the influencers in those communities. And even afterwards, during our co-creation activity, we still had sessions whereby the youth helped us in identifying the stakeholders in their communities, those influencers in their community that would help us to bring about the change, that would support the change that is desired. So it was more like a joint work. We did that at the beginning. They also did that when we were having our co-creations activities with them. Thank you.
Thank you very much. Any other questions? James?
Forget about my one. There's loads more coming in. But I thought that was a phenomenal presentation, and that particular quote about they don't need to learn the word systems, they already live it. I think, yeah, it hit home very hard. So yeah, amazing. No, I won't ask any questions. I'll leave it to others.
Okay, thank you. So Kira has a question around how do you evaluate the programs, so the process and the outcomes.
Thank you. Like we said, the project is actually in different components and phases. There's also a monitoring and evaluation aspect of the project that comes along after we've already identified those barriers. And now that we are in the process of, we already planned the intervention. So after that, doing that, we will be having the monitoring aspect and evaluation aspects by the team. So that's what we are doing by using different tools, definitely, yeah, to monitor and the outcome.
Maybe I could add. So we have reflection forms after each session to fill in also about the process, and that also helps to immediately adapt the process to the youth. And we're doing a realist informed ripple effects mapping to evaluate also the impact of the implemented actions and their ripple effects.
Brilliant, thank you. I see we have some questions in the chat. I'll come back to them. Oliver, you have your hand raised if you want to ask your question.
Hi, thanks. A really great presentation. It was really interesting. Thanks for that and understanding how you're using these methods in very different contexts. I was wondering, how are you moving from understanding the context and the problem, and you've developed your systems, how are you moving from that to then co-developing your interventions?
Thank you very much, Oliver. Okay, so after like I said, we had the mapping exercises, mapping stage. After all, we actually had to tailor the intervention because at the mapping stage we had the result, which was the systems map. So the co-researchers and the stakeholders, we still had to go through processes of tailoring those actions. So after that, we were able to refine the interventions that would help to sort out the problems that were identified. So with that, so it was like an inclusive process whereby everybody participated. So we went through a process of refining, redoing and all that. So right now, we are now at the stage of planning that intervention with everybody being involved as well.
That's great. So just one more follow-up, if that's okay. How many interventions did you come out with? Because my experience of co-development interventions is you get loads.
Okay. On our side here in Nigeria, we actually have like 4 action ideas, 4 action plans. But we have one that is now the major intervention, which is the after-school program. Yes.
Okay. That's brilliant. Thank you. So we've got some more questions I'm just gonna ask. So one from Danielle asking, did you have any formal decision-making processes or policies in place that put young people at the heart, or was it mostly informal? And if so, how did you develop this?
Please come again. I didn't get that.
Yeah, so the question is, did you have any formal decision-making processes or policies in place that put young people at the heart, or was it mostly an informal thing?
Okay, so I would just say that, like we said, it's more of a co-creation activity. So from the beginning, I would say that in our own context, we actually made use of a secondary school. And we had to seek permission from the school administrators for the student to be part of the project and to become the co-researchers, the people that are involved in the whole process. So it was more like, I can say it's formal and it's informal, but the fact that at the end of the day, the stakeholders still involved the policymakers at the Ministry of Education. So all this was kind of a combined effort. And so in the real sense, earlier I talked about the cultural context that doesn't really allow young people to speak out. So those were things that we tackled earlier during the beginning stages of the project, whereby they realized that these co-researchers, the younger ones, are actually the voices to identify these problems, and they should be given the room to talk and the space to talk. So, and earlier I talked about the fact that we also had to have separate sessions at some point, then later we merged some sessions. So this actually helped them, the older ones, to identify the roles of the younger ones as tools in helping them to make better decisions when it comes to the solutions and the intervention. So I could say it's actually a combination of both. Yeah, thank you.
That's brilliant. Thank you very much. I think that's everyone's questions in the chat. I don't know if anyone has any other questions for Mai or Adefunke. No? Oh, sorry, James Woodward, sorry, no Nobles.
Can you hear me now? Is that
yes.
working? Yeah, okay.
Thank
Sorry,
you.
I thought I'd just hop in quick. I was just typing up, but I'll catch it before we go. I just wondered around how you found how you found approaches to engaging some of the young people that maybe either already were really disengaged from this type of work or really disengaged because of their personal circumstances or history or experiences of trying to engage in physical activity.
So, James, can you help me again with the question? I didn't really quite get that.
Yeah, sorry. So it's around, I just wondered if applying this approach into other spheres, in other kind of settings and places, you'll have a group of young people that could be really interested, engaged, and are really pioneering and leading each other through this process, which it really sounds like from what you described. You have people kind of re-leading some of this. But how did you find it in cases where people maybe weren't particularly engaged, or maybe originally felt from the get-go, oh, I don't know if I want to engage with this work?
Okay, so I will just start from the beginning stage, the fact that we actually had to share consent forms for for the two students and even their parents. We had accents, we had consent forms. So from the beginning, the parents had informed, they had enough information about the project and were able to make informed decision. Although rather, when we still got into the corporate session, sometimes some of the teenagers might be a little bit, kind of disengaged, like you said, and that's why we actually made use of those games that I highlighted earlier. Most times they really want to play, they really want to play. So we actually did it in a way that while they are playing, they're also giving us responses and the answers that could help us. So more like imbibing the activities in fun games, help them to now do it better. So it's really went a long way helping us to achieve the result that we have. Yeah.
Yeah, maybe I can add to that adults and in particular academics really like talking and words and writing, while teenagers like to play. So the less it looks or feels like school tasks or house chores, the better. So you really have to completely rethink your way of doing research. And that's why you need the youth as co-researchers, because they know what they like, what their lived experience is, and we only know adult boring stuff.
Amazing, thank you.
That's brilliant. Thank you very much. I'm going to just pause the questions for there now and go on to the next presentation, if that's okay. But thank you very much, Maya and Adefunke. That was brilliant, and I really enjoyed it. I think I can speak for everyone on that. So thank you very much. Our next presenters are Therese and Clara. So Clara, if you want to share the screen, I'll just get your introductions done. So Therese and Clara are postdoctoral researchers working with systems-orientated prevention at Steno Diabetes Centre in Copenhagen. They are a part of the research group Systems-Oriented Prevention, which brings together 10 to 15 researchers from diverse disciplinary backgrounds to strengthen primary prevention of complex health challenges in Denmark. Their work focuses on the development, testing, and evaluation of systems-based approaches and other innovative approaches, with a strong emphasis on real-world implementation. And I'll hand it over to you, Clara and Therese, and thank you very much.
Thank you, Sophie. So again, I can't see you, so please scream for me if anything is wrong. But thank you so much, and we're very happy to be here today and talk about our experiences in Denmark. And we're going to talk about how to communicate and use a systems map developed through group on building, and what adaptations we have experienced are necessary in diverse settings. And as Sophie mentioned, we are a research group called System-Oriented Prevention, which brings together at the moment 12 researchers, and we are located at Steno Diabetes Center, close to Copenhagen in Denmark. And we work both on diverse systems-oriented programs at the moment, and we work very close with practice and also work to evaluate these programs. Yes, and the last 5 years or so, our research group have applied group model building quite a lot to co-create changes in practice in diverse settings and systems. And group model building, most of you might know it, but is a qualitative method to support a shared understanding of complex problems through participatory systems mapping, detect leverage points, and develop actions for change. And our role has been to both to facilitate the process, but also to build capacity to other actors so they can run the process locally. On Scriptopedia, detailed scripts are available describing how to run a group model building process consisting of 3 workshops. And when we first began applying this method, we adhered quite strictly to the pre-described scripts. But over time, we realized that it was necessary to be more adaptive, both in relation to the specific context in which the method was applied, but also during the GMB group model building process itself. Yes, and for you today, we have tried to synthesize key lessons learned and developed a set of recommendations across 4 settings: schools, communities, municipalities, and a more strategic partnership level at national scale. So the first one is the school level we want to talk a little bit about. And we have run quite a lot of processes in individual schools across Denmark, mainly secondary schools, with involvement of both students, teachers, managers, and also the surrounding community around the schools, so community actors. And what we typically experienced was a context characterized by limited time and many competing priorities. School actors are very focused on immediate practical solutions. As a result, the participatory process sometimes felt way too long for them. And several participants also struggled to see why we needed to develop a systems map in the first place. So our recommendations for this group is to use local problem-specific data to increase relevance and motivation. For example, if we are targeting physical activity, collect physical activity data locally prior to the workshop and present the data for participants. This is very engaging and motivating for all the groups. Keep workshops short with clear structure and strong facilitation in a non-academic way. Avoid creating full causal loop diagrams in software. Use post-it based mapping instead. And the last one is use simple, easily understandable frameworks to detect leverage points. For example, the action scales model or similar frameworks. Yes, and I will hand it over to my colleague, Therese.
Yeah, I will talk a bit about the community level, and there's substantial overlap in our experience from the school context, but also what I could hear in the YOPA study as well to the community level. For example, the use of the local data is really important in the community setting because it's perceived as a motivating factor for the participants. It's allowed them to get some knowledge that they are not used to getting. So it's really engaging for them. But there's also some differences when we go to community level compared to the school level, and that is that we have a more diverse participation group in the community setting. And the starting point is different because the educational background is different and the familiarity with the academic or professional language differ a lot, which influencing the concept and how they understand the discussion. The participant may also differ in the sense of belonging to the community, for example, between long-term residents and new members, which can influence perspective on local challenges and solutions. And finally, there are often important distinction between actors who are volunteers or they are professionals. And they may bring different roles, motivation, and experience into the rooms. Together, these factors may give rise to implicit power dynamics, highlighting the importance of being attentive to how participation and dialogue unfold within each workshop setting. So our recommendation for this group is to facilitate in a non-academic accessible language with deliberate attention to keeping the readability level low so that all participants feel included and spoken with rather than spoken over. Use local data in combination with storytelling around the issue of hand. The incorporation of participant storytelling is important. However, incorporating storytelling in the review of a causal loop diagram can place a considerable amount of demand on the facilitator and the facilitation skills. The use of images in facilitating the causal loop diagram can support some participants in grasping the complexity of the causal loop diagram by making it more visible and intuitive. So here, next slide. Here is an example of how we may use pictures in combination with storytelling in the facilitation of the causal loop diagrams when we are working with the communities to help simplify the complexity. Then I will go further to talk a bit about our reflection at the municipality level or the more strategical level. Here, the group of participants tends to be more aligned, and participants often have a higher degree, a higher academic background, which allows for a higher level of reflection and abstraction. And they generally share a baseline familiarity with evidence related to the issue of hand, which lead to that the communication here can be more academically oriented and assume greater background knowledge compared with facilitation in a local community setting. Some of the things we would recommend in such a setting is work with education and capacity building within the municipalities is really important, both in regard to understand the use of system thinking, but also facilitation skill, introduction to different tools, how can they use them in practice, more analytic capacity and evaluation support. Work with applying system thinking within strategical planning is also a focus and decision-making process by, for example, as you can see on the screen, systematically linking the implemented actions back to the causal loop diagrams and track which actors are responsible for their delivery. This helps maintain an explicit connection between future plans and operational activities. Further, we also recommend that the causal loop diagrams are used more analytically to identify areas of the system where the interventions are currently lacking. For example, when municipalities receive political mandates in Denmark, it could be close to New Year. They have an amount of money that they needed to spend before January. They could initiate a limited number of action within a specific political area grounded on existing causal loop diagrams, which can inform them where are there lacking actions and where could they be most effectively to put actions in regard to the causal loop diagrams. In addition, applying these methods over time also supports the ongoing monitoring and evaluation, enabling the municipalities to assess system development, adaptation, and alignment between actions and the broader strategic goals in each municipalities.
Yes, and we have also experiences from using group model building on a more strategic partnership level across two national partnerships in Denmark, one working across organizations and sectors to increase the intake of water among youth and reduce sugary drinks, and one with the ambition to increase physical activity in schools among children and youth, both at national scale. And these actors are professionals, maybe policymakers and expert actors with high level of problem expertise and a shared conceptual language, but there is also a risk for over abstraction and distancing from implementation realities. So our recommendation for this group is to set clear system boundaries as an explicit exercise. This is especially important at this level because the national level are so broad, and maybe it's also necessary to be open to develop more systems maps if necessary. Involve relevant practice partners in the process if these are not a part of the partnership already. This is very important. And in this group, we have great experiences of using a dedicated software for system representation to support strategic dialogues, for example, Kumu or Stige. And at this level, triangulating the systems map with existing empirical evidence might also be relevant to enhance the validity of the maps. And finally, we see it as an advantage that the systems map in this group can be used as a working tool for ongoing reflection, development, and evaluation within this partnership. Yes, and this was our experiences and recommendations with group model building across various settings. And please feel free to reach out if you have any questions or anything.
That was brilliant. Thank you very much. These presentations are so interesting. I'm just like scribbling notes for my own work. So thank you very much. It was particularly helpful as well to see the different contexts, like the school environment and how you communicated that differently. So thank you very much. That was brilliant. Again, I'm going to open this up to Q&A. If anyone has questions, feel free to raise your hand or post in the chat. And yeah, we can do both.
I've got a quick question, Sophie, just to kick us off. I loved like how you kind of pulled that apart a little bit in terms of the different contexts. And I thought therefore the recommendations that you put forward were really interesting and specific for those different groups that you might be working with. One of the things that I noticed in your talk and also in Adefunke's talk was like how powerful stories were, and reflecting on like some of my own work as well. Like we have tried to do, and probably not done it as well as others do, tried to use storytelling at the municipality level, at kind of a strategic partnerships level too, to make those more like abstract maps tangible. And so I just wondered what like your experiences were in, did you use storytelling with the municipalities and with strategic partnerships? And I wondered what your reflections were on why that didn't come through necessarily as a recommendation for those groups.
Should I start, Clara?
Yes.
Okay, at the I can take the municipality level. At the municipality level, I think in Denmark, they are much more academic language used in the municipalities. And people are not living necessarily in the municipality where they work. So their stories are different from where they live and they live lived. So it's more about, many of them are referring to the literature. What have they read? What do they know about the problem at hand? So the storytelling is different here. And the focus is much more about bridging between the different silos in the municipalities, because their languages are different. So like we are talking here about how do we actually understand system, what is systems, what is system thinking, it's the same there. They can be discussing how they understand physical activity in one department who's looking at health, and the department who is developing the city is looking at physical activity in a different way. So actually the language is more at focus in the municipality. So there's also storytelling, but not storytelling about the lived lives like I talked about in the communities. So it's quite different there. Yeah, I hope it makes sense.
Thanks, Therese.
Brilliant, thank you. Mai, do you want to go?
Yeah, thanks a lot for this interesting presentation. I was wondering your slide about schools with the time pressure and the competing priorities, which is very recognizable. I was wondering the group model building sessions in the schools, were they on a topic that was identified by the school or identified by you or the municipality, or someone else?
Yeah, that's a good question. That's a bit different from program to program, but the large program I've been a part of, we collected a lot of health behavior and well-being data before the schools selected the problem they want to work further with. So we presented data for them, and they could choose the problem they want to work with. And we also we also asked students, which topic do you think is most interesting to work with, and the teachers, and also presented that data for the management. And then the management had the final say in this process.
That's brilliant. Thank you. Has anyone got any other questions for Therese or Clara? Feel free to put them in the chat or to raise your hand. Whilst we're waiting for people, I actually have a question, so I'm gonna just jump in if that's all right. So you talked a lot about the differences of across contexts and communicating differently across contexts, and I was just wondering, from if you're someone coming into this area who hasn't had any experiences of across those different contexts, what advice would you give for actually being adaptive in the way that you communicate across those contexts? Does that make sense? I guess, well, yeah, what recommendations would you give to someone who isn't really used to changing how they communicate with, for instance, academic audiences versus non-academic audiences versus partners versus participants?
Yeah, that's a good question. I think you should start by get a little bit to know the group you want to work with and the people you think will be a part of the process. That's a really good starting point. We have a lot of meetings prior to this process with, for example, the schools and teachers and also students, like to get to know them a little bit and in their language, to talk of kind of the same language when we're going to facilitate these processes also. And the same with the communities, I think, Therese, right?
Yeah, I would say it's a process also for you as a researcher. So, and you need to learn to speak differently. And I think it's one of the most overseen skills is actually that you have to make something so complex easy to understand. It's a really hard journey, but if you are capable of that, then you can go really long into this system in diverse context. But it's also a process, and you learn. And here in Denmark, we probably would say, in Danish, we will call it go drink a lot of coffee meetings, go out and be part of the context to understand it and be aware of the stories, the words they're using. They could be very different. And that was also what I was saying about it's demanding to be a facilitator in this kind of context because they can use words you're not used to, but you have to grab them and use them as it's your own words as well. Yeah.
That's brilliant. Thank you.